Hi everybody, I'm Dr. Qazi. I'm a skin restoration specialist in Newport Beach, California. I focus mostly on acne and scars and pigmentation. I'm going to walk you through the process for subcision tonight. We're going to talk a lot about how I do subcision and what we could do to make sure it's safe and effective and give us really consistent results. So I'll go through kind of just the different layers that we use when we're doing subcision to make sure it's as safe as possible, and then also just the different tools that we use, and just in general, just the technique that I'm doing, which is a bit different than a lot of other practices. So I'll talk to you about just the overall when we do it and why we do it, because I think it's pretty clear at this point that it works for the right kind of scars. But there are some places that will tell you that either you don't need it when you do need it, or sometimes they do it when they shouldn't be doing it. So I'll kind of hopefully help you, guide you to showcase when you should do it, and maybe give you a little bit more options for volume loss also, and for those rolling scars. So let's wait for a few more people to join us tonight, but this is what we're going to talk about mostly tonight. If you have other questions about acne, about scars, about pigmentation, or just generally for things that I do, I'll be happy to help you as well. But I'll walk you through this process right now. If you look at this photo that we have up right now, this is actually a patient that had tumescent fluid in there. So that means that there's a bunch of numbing solution there. And you can see that pocket where it's being pulled down, that's where that tether bond is. And so I'm working on it to actually break up that scar tissue really effectively. That's really a big chunk of what I do with subcision, is just manually breaking up individual scars like that. I don't really believe in like this big, what you can call like a windshield wiper movement, where it's really, I would say, not precise and potentially could cause a ligament damage. So I'll kind of showcase for you just the different techniques that I use, and the needles and cannulas that I mostly use as well. Some patients I see are on here. Some people actually that have done subcision, so maybe you guys can even ask them sometimes if they're on here about how it was. Everybody worries about it. I would say that they say, well, I see the videos that you do, and they get a little bit nervous about what's involved with it. And it does seem like it's daunting. It seems like, oh, wow, this could be potentially, painful, or it looks like it's uncomfortable. But the thing is that we make sure that there's a ton of numbing solution in there. There's so much in there, so you don't feel anything as we're doing it. The thing is that you do feel is the pressure. And so that's something that like you feel like there's like a little bit of pressure as we're breaking up that scar tissue, and it's like this tugging sensation. And it's like, okay, once you get that first tether bond broken, it's almost like cathartic, actually. That's how I view it. Like, I think it's kind of cathartic when I break up that scar tissue. And maybe, I would say a vast majority of patients actually do too. It's like once they've kind of realized that's what it is, it's like, okay, not too bad now. Actually, I could do this. Like I just broke up, 20 years worth of scars right now just in your face like that, which is pretty cool. Think of it that way, maybe that'll help. So what are your thoughts on CO2 Deep Effects laser? I got recommended that by this plastic surgery center in San Diego. Deep Effects is what I use a lot too sometimes, but you don't really necessarily you don't actually necessarily have to worry about the CO2 laser, by the way. You don't really have to. The different brands don't matter as much as you think. The truth is that when we're doing these treatments, it's a lot of it is really with this manual work, really to get the best possible results. And the laser and the brands of the lasers, don't only matter up to a certain point. You don't need as much energy as something like Deep Effects, for example. Just to be clear, like you don't really need to go and bulk heat that way. Hi G, good seeing you on as usual. Thank you so much for coming on. G saying great result, appreciate you. So I'm showing right over here the different layers. Actually, let me try to make it a little bit bigger for you guys to see if you can see this better. So we have the epidermis, and you can see what I'm doing mostly is in this dermis region. And I actually stay with that. Some people do the subdermal area where you can get pretty close to the fatty layer. And that's why I don't actually do it that way. So I don't do the subdermal. I mostly stay intradermal there as much as I could. Have any recommendations for Northern California locations? I can't say that I do. Honestly, I have a lot of patients from Northern California, and they've tried a lot of different things from practices up there. And, I haven't really found anybody that they've said that they, were wowed by or anything like that at this point. But maybe there's something, that we'll find out one day. I keep an open mind. What about Bellafill? So Bellafill is really for that volume loss, like collagen loss there. So that's where it's really useful. But it's not going to solve the tether bond there. So if there's there's these stuck bonds there. Sometimes if you put filler or some sort of product there, it'll actually go around the tether bonds, and it's not going to go exactly where you want it. So you definitely want to do subcision for the right rolling scars first before doing a product like Bellafill. Someone's saying, I tagged you on a girl's TikTok who's looking for a good doctor for her scars. Thank you so much for that. I appreciate you. I always appreciate those tags, by the way. Thank you so much for that. And sometimes I do see these things also like on there where people are suffering and they seem like they're further away though a lot of times. But it's like, I like the fact, and that's why it was making me so sad that they were trying to take TikTok away, and it's only like a 90-day extension. So hopefully it comes back. But I like the fact that like people are pretty authentic on this platform. It's like they just showcase their acne and their scars and the whole process, which is really cool actually. I wish I had that when I was younger and I was going through this process. It just that kind of community. And interestingly enough, when you look at the comments, a lot of times it's like really supportive actually. Like people are very, very supportive on this platform, and much more supportive than a lot of other platforms. So it's interesting, it's like they're so scared of this algorithm, why don't you just make your platform better and make it so that people feel more comfortable using it and things like that instead of doing that. Because it's like, it's awesome that when you see like someone sensitive, like talking about their acne and talking about their scars, talking about anything like that, or like some sort of insecurity, like the comments are very, very supportive. And it's not like it's like filtered out. It's just like immediately you start seeing that. It's really cool actually to see. So it's interesting, actually. It also goes to show that people end up, are a lot better than people expected. I was looking at for the longest time on social media, it's just like negativity. And then I see like these things, and I realize that there's so many better people out there than we were told, actually. And even just right now, look at the live, like look at the feedback where we're getting right now on here. Look at all the comments and like look at how positive it is and everything. It's really interesting, right? Like it's really interesting. It's like, yeah, I think part of it is just the community over here for our lives, but also just the platform too. It's like these people show their vulnerability, and people aren't bullying them. It's pretty cool. Like back in my day, it was like people were like enjoyed bullying. It was like the people just thought it was like the way to live was just to bully others, and it was like part of life, and it's ridiculous. It's awesome that I think we kind of all grew up with it. It's sort of like, at one point it was just acceptable to hit your kids, and like now it's just like you just never do that. It's just like now we just understand, just don't do that. And we realize that that's just like, there's so many better ways to be, to parent than doing that. So it's like kind of interesting that everyone's so upset with like our generation, or upset with like the way that progress is in the world. But we did change that. We like changed, like that's like gone. And within one generation, the hitting and all that kind of stuff, 1 or 2 generations is just gone now, which is cool. What is this? This is subcision. This is basically where I go inside and actually break up the scar tissue. I'm breaking up the tethered bonds that are pulling down the scar, which is pretty interesting. So we could go in there and actually manually break up scar tissue like that. And that's how we could actually help pop it up. So I'm showing some of the patients that I've done it on there. And it's pretty cool. It's like, it's really rewarding, because sometimes that's all we need to do, especially if there's not much volume loss. I'm up and saying, I've seen a lot of people worried about having Taylor Liberator subcision done from hearing stories of others having issues done due to inexperienced doctors performing it on them. That's something I've heard a lot of too before, and I'm fully aware of it. It's important to pay attention to it. I definitely think that we should always pay attention to these kind of adverse events, and a lot of things have to change really in the industry, and a lot of things have to change just with techniques in this particular industry too, with scars. Some things that I will focus on and explain though is that most of my work is with blunt cannula subcision. Vast majority of the time I'm using blunt cannula subcision, or sometimes I'll use something called a Nokor needle, which is just goes right underneath the surface and actually break up that scar tissue right there. But Taylor Liberator I have to use sometimes, and if I need to use it, I'm just going to use it like really, really carefully. And the way I do it is it's like I will find the bonds that with the blunt cannula that I need to break up, and then I'll use a Taylor Liberator for those specific spots, those particular pockets that I need to do. So it's really very, very, very precise. And that's how I could do it very safely. And I really, really rarely do it in areas that could cause that sagging really. I would say, almost anywhere you could have that risk, but especially in the lower part of the face, it's riskier. And then you could run into a lot more problems in the temple with this, with hitting vessels in the forehead with it. So blunt cannula subcision, you could do a lot with it, and it's just about like being patient sometimes, like just constantly chipping away at it, constantly working on it. There has to be a way to, have people just learn to either, if you're going to do this, be really, really patient. I had somebody a long time ago, he told me that when you think you're done, you're not done. And it's like it always sticks in my mind. You think you're done, you're not done. So I always double check, patients that know me know I do that. I'm like, I'll double check, I'll triple check, I'll quadruple check sometimes, just go over and over and over again. I'm like, not 100% sure. I'll just go check again. Like if I'm done, I'm done. But like I'll just keep on checking to see to make sure that that needs to be broken up in a different way. What dictates whether or not a scar requires a Taylor Liberator versus blunt? Well, it's part of it is just in that intradermal lesion area, which is showcasing right now. What we want to do is we want to make sure that as we're pushing in there, we're feeling pretty smooth. And if there's still a lot of scar tissue, still a lot of those tethered bonds, we likely have to go and to do something else, like a different tool. And of those tools, Taylor Liberator is excellent for that. Really, it does really nice, a really, really great job of actually breaking up those tethered bonds in the particular layer that I want to. That's really what it comes down to. Like as I'm going in there with the blunt cannula, I'll test to see if it's something that I should be pushing with the blunt. Okay, great. I could break it up with that. Awesome. If not, then I will use something like another tool like the Taylor Liberator potentially. And I do prefer that over like other tools, like something like the Tulip, which is like this prong one, or like there's a fork one also. I find that those ones are a little bit too harsh, a little bit too sharp. So Taylor Liberator I found was really, really nice because it really can just break it up without as much trauma and without much risk of like pushing some fat as well there. So different things like that are what I'm looking at. And that's why it's kind of tough, honestly, to teach because really, to be honest with you, I think one of the big things that makes me different is the fact that I am a DO, an osteopathic physician. And, in America, osteopathic physicians do full med school, like completely the same as MDs. But we do this additional course, which is basically for palpation, for like feeling with their hands. And honestly, it's interesting because that whole training, which I kind of was annoyed with sometimes during school. Anybody that's in med school, like as an osteopath, may know about that course. It's like was required and you had to do so much of it. But one thing I took out of it, which was really good, my mom always said, always try to take something good out of everything. And so I did try to take something really good out of it. And I really did learn, like I was like, if I'm doing this, I'm going to learn this. And I learned how to feel with my hands. And it was like really, really useful in this world because like now I could feel the skin, I could feel a tension on the skin, and I could feel a tension with my cannula. And that's how I could actually make sure that we could be very, very safe. And I only do things that, exactly what's needed for the patient. And it's, I think probably the big difference maker is the fact that really we could just feel with our hands a lot better there. And I would say that that's really something that like DOs could do. So interesting enough, it turns out that was like an interesting class. At one point, I was very upset and annoyed about. I'll tell you that, really, I was very, very annoyed when I was doing my osteopathic classes in med school, and I took away from it how to palpate really, really well. Vinny Shelby saying, I have a very bad scar on my nose from a botched self microneedling. Really hoping you could help me. I have an appointment on the 10th. I'd love to see you. I will help you out with that. The nose scars sometimes can be really, really challenging, so it may take a few sessions to actually smooth out. But that is something I do a lot with, though, a ton with. There's ways to do it. I'm on my second round of TCA Cross and struggling with hyperpigmentation from this round. Any recommendations? Did they pre-treat you? They always really should pre-treat you. Michelle saying, oh, hey, Michelle Moonfox is saying, I had subcision with Dr. Qazi and my face did not sag or fall off. Thank you so much for it. Thanks. I look forward to seeing you when you're coming in again, actually, by the way. Look forward to coming in. Are the purple marks on that pick for excision? Actually, I got to double check which one that was for. Sorry, I'm not sure which one that was there. Let's see here. Are you talking about the one that was the, let me see. I'll double check to see which one that was. After subcision and lasers, would microneedling be a good option? Yeah, I mean, that's not a bad option. It's like, it's cheaper for you. You could do that just to kind of maintain some results. But sometimes what could end up happening is that it could make the scars a little bit wider. So I don't love it for ice pick scars, even some boxcar scars sometimes, to be honest with you, unless it's like pretty superficial. Castro is saying, I'm looking for a good doctor for deep acne scars. Been doing lasers for 2 years, but no results. Yeah, you may need other modalities. It's probably not going to be just, laser. That's what the problem is. Ariane is saying, I got my 5th CO2 laser in December, but it's not completely gone. How much do I have to wait for my scars to go completely till I have my 4th CO2, 1 PRP, 3 subcision, and I'm Indian, 19, non-smoker? Okay, so let's go through that. Ariane is an Indian non-smoker, good. 19 years old, also good. Hopefully your oil is under control, acne is under control. I'm assuming it is. But he has done 4 CO2s with PRP and 3 subcisions. Okay, and he's saying the acne has not completely gone. So I'm assuming it's gotten better though, so that's good. It's gotten better. The thing is that you may not get it gone completely, like really. And if you look at these results, you'll still see some scarring, and we're still a lot of times in the process of things and all that. But it's extremely difficult to get a complete smooth skin. Even if you do multiple different laser sessions, it's extremely, extremely difficult if your start point was very, very deep, severe scars. But you'll notice that some patients, when it's more like volume loss and less with like the thickness of the scars, then yeah, we could potentially get to closer to that. It's kind of close to that enough. So maybe it sounds like you've done CO2 laser, PRP, subcision. Maybe what you need is volume. Maybe you should take a look in doing fat transfer. You should take a look and see about doing, Radius or Sculptra or whatever else is available for you. But if you don't have much fat or something like that, maybe those are all options there for you. It's Nazine is saying, I have a little scar on my cheek. Can I send my picture to ask you which is better for me? I'm in Iran. Yeah, you can set up an appointment through my page at drqazi.com, and then we'll be happy to set up a consultation with you. So just go to drqazi.com. Our prices are on there as well. We can go ahead and set that up for you. Let's see, I missed a few questions here. Stay True, I think I got you over there, Stay True. Stay True is asking, how many sessions of under-eye PRP do patients usually need? What about maintenance treatments? So that's a good thing. That's a good question, actually. For under-eye PRP, it could take a few times, really, because you really are trying to get new blood flow there, and that's a slower process than people may expect. Sometimes it's about 3 or 4 sessions, and then usually do it 1 to twice a year after that. Hannah Shaw is saying, I got halo and Profactional on my face for acne scars, and now I'm very worried about the healing time since it's almost 3 weeks now, and I'm still very, very red. Am I burned? Well, 3 weeks later is not bad at all. I'm not sure what they used for post-care. A lot of times it's just very, very dry. You just have to use a lot of moisturizer. I don't love halo for scars though, really. But I do think there's a little bit too much heat with it too sometimes. But yeah, you're gonna be okay if you just use a lot of moisturizer, sunblock, prevent that from pigmenting. It should be okay. So in my practice, I don't really use halo for scars. I don't really ever see a need for it. I know it's pushed a lot by a lot of people, and that's okay, I guess. But I never really see that they've ever showcased amazing results with it. By the way, I have a tattoo that used serum not on stretch marks. It left hypopigmentation scars. Will Pico work? For hypopigmentation, no. For hypopigmentation, you probably have to do something else, potentially tacrolimus or something else for that. It depends. Maybe you could use a localized form of a CO2 laser to trigger pigmentation there. How do I control oiliness in my skin? Well, different options. So oil, really, think of it really as a sebaceous gland that you have to really control. Otherwise, it's pumping out too much oil, and sometimes it's due to hormones. So if during your menstrual period, it's possible that you are essentially triggering the sebaceous gland to push too much oil. In which case you may need to be on like an oral contraception, like something like Yaz, where it could work well because it's got estrogen and progesterone, or you may want to be on something like spironolactone, which could help also with especially a menstrual period, very particularly with patients with PCOS. It could definitely help with that. But that being said, if you really have excess oil like throughout the whole month, or it's just like, it's a lot, and you're having cystic acne, then you may need to do something like isotretinoin, or you could use the Cure laser. A Cure laser works very similar to isotretinoin or Accutane, and topical creams, of course, would be like retinoids, like tretinoin, different gel. Those things will all be options as well. I missed a few other questions. I'll try to hit those before I'm done for tonight. Let's see here. Where was I at there? How far apart should you get a laser treatment done for acne scarring? Usually I give a pretty big gap. Sometimes it's like 6 months, even a year sometimes. It just depends on what your skin type is, to be honest with you. It's tough to say because some people do heal really rapidly, but I always try to give myself a bit of a buffer. So I usually say about 6 months or so. Oh my God, what is this live? How do I fix these deep dot looking scars? Good thing you found me. That's what I do. That's what I do all day long. So this live is with me, Dr. Qazi. I am a skin restoration specialist in Newport Beach. And I'm showcasing in this case with acne scars and how I treat it. What I was showing was with Subcision. This is another patient that I did Subcision on. Just the process for Subcision. So we go underneath the skin and we actually break up the scar tissue to help pop it up there. The photo just passed, but it's a close-up with a purple marker. Are those meant for excision? Yes, those would probably be for excision, but sometimes I also do it for if we're going to be doing some little bit more volume as well. So if it was just like a small little circle spot, then that was for excision. I still missed the photo, so sorry about that, but it's probably going to be excisions then for that point. The monster is gone and saying, as someone with acne at 27, this type of skin is one of my biggest fears. There's ways to avoid it. Make sure that you're controlling your cystic acne. I've had a lot of patients with very severe cystic acne who didn't scar much because we cleared it up pretty quickly. So if you need oral antibiotics, topical antibiotics, just consider doing that, jumping at that. If you need to do something stronger like isotretinoin for your acne, then do it just so you don't scar. It's the most important thing is do not scar. And try to avoid it. Like if it does happen, I'm here for you. I'll help you out with it, but I want you to avoid it. Avoid coming to someone like me. I was saying yesterday, I was going through a whole thing yesterday about how to avoid scarring. And it's like medicine is like really the only field out there where we try to get people not to come to us. It's kind of interesting when you actually think about it. 29 Revenge is saying, what to do if barley have or if you hardly have any deep scarring, just redness which hasn't faded for months or years. So you could use XLV, works well. You could do V-Beam, that's okay. Derma-V, all good options. I use like a XLV usually because my patients are typically a little bit darker skin type, and we have less chance of pigmentation issues then. Pamimi is saying, so do you one laser with Subcision, TCA Cross, Bellafill, or some other treatments? The next session is after 6 months. Yes, for the laser portion, it is usually like 6 months, even a year later. So that's why sometimes like if someone says how many sessions, it's like I do different things in between the time. Usually, like for example, this patient is a perfect example of that, where I did TCA Cross, I did a little bit of Bellafill after we did the laser session and Subcision. But it's not like the same thing that I'm doing over and over again. The first session I did Subcision. I did, actually in his case, I did some excisions as well. I did a little Bellafill as well, and laser resurfacing. So I did a few different things, but it's like I didn't do that over and over and over again, the same thing. Let's see here. I missed a few things here. Where was I at? Can CO2 on African American skin? I'm not very dark. Technically, you could sometimes. It depends on what we're trying to treat. If it's like very, very severe, deep, thick scars, then maybe we would do CO2 laser. But usually, I'm usually going to use more of like an erbium laser on African skin type, especially the first time. I want to make sure that we don't run into problems with overheating and causing hypopigmentation. That's the biggest thing I like to avoid. What to do for underboob acne for a person with heavy chest. So usually you want to be on some sort of topical antibiotic over that area. So like something like topical clindamycin could probably be the best option there. So topical clindamycin, really good option. And then if you could tolerate it, a nice retinoid is actually a cleaf. A cleaf works very, very well as well on the body. I find it's not as irritating, but take a look and see if that's something that is irritating though. Aryan is saying, thanks for answering my question, Dr. Qazi. One last thing, my scars are reduced, but I still got hyperpigmentation after my last treatment. The doctor suggested 20% azelaic acid. Will it work? So I'm guessing you had redness, red marks afterwards. Then that's good. Sometimes I think 20% azelaic acid is a little bit too strong. So I do about 15%, that which may make a bit of it may not seem like that much of a difference, but sometimes that's what's needed actually. You don't want to overly exfoliate. Especially when it's like redness. Something to consider though. Do you do all of them at once, or what's the downtime for each treatment? Yeah, usually I do a bigger combination session in a single time. And then in the future, what I do is more like TCA Cross or a filler, like Bellafill, for example, or Radius or Sculptra, something like that down the line. But the initial time, yes. Can razor bumps also cause scarring? Yes. What do you use to shave? I don't like electric razors in acne-prone skin, so just something to consider. It's possible. I know Gillette has like 5 or 6 little blades. I'm not sure how many blades they have nowadays, but maybe just something like that. Or use a straight blade. Do something else. But electric razors, I find, can cause more friction for patients with acne. Can you use laser to get rid of flat hyperpigmentation scar from burn? Yeah, you can use a pico laser for that. How long is a downtime after each treatment? So for the bigger combination session, when we're doing subcision, we're doing ablative CO2 laser, or fractionated CO2 laser, for example, and let's say we're doing TCA Cross with that, that's usually 4 to 7 days of downtime, usually. If you did the same thing over and over, would you get better results? Not necessarily. In fact, this is this patient right here, he didn't end up getting hyperpigmentation. He did have like some redness for a little bit longer, but he's East Asian descent, and you could get more prolonged hyperpigmentation. Sometimes in certain ethnicities, you can get hypopigmentation. So your risk reward is not really worth it to do the same thing over and over again. And I'm not sure why you would need to do it over and over again, because I broke up that scar tissue really effectively. It's done. And we don't have to worry about that anymore. So it's done. Unless you have new acne and things like that, I broke it up, it's over. And so now we can talk about doing filler, volume, things like that. What would you do if laser caused small hypopigmentation dots? You could do tacrolimus initially when the scabs come off. That's actually a good time to do it. And then you could find actually just after a couple of weeks, you could get some pigmentation coming back after that. So just tacrolimus just briefly. And then you could also do a little bit of UV light actually. So you could do either at home UV light, or just have patients use sunblock everywhere outside of those little hypopigmented areas and just get some UV light just for 5 minutes or 5 to 10, 15 minutes or so. But I'm not sure exactly how much hypopigmentation there is, but it is likely, especially if it's due to laser, going to respond and wake up that pigmentation over time. Under eye circles and hollowness, not bags. What's the best treatment? Is it PRP? PRP could help for the vessels. Let's say there's some coloring issue that you want to improve. It'll help more for that, but it's not necessarily going to help with volume, for example. It'll help a little bit with crepiness as well. But true volume loss, you need to do something like volume. So that can involve fat transfer or filler. And other fillers, you want to do fillers that don't draw on too much water. So I usually Restylane Classic is a really good one. Or you could also do Bellafill in the mid cheek. That's actually a good spot too. Jacob is saying, I am 19. I recently started shaving and had perfect skin before, but I have been noticing some small dents. What are you shaving with? That's what I was just actually talking about. That's the thing is that actually a lot of it depends on what you're shaving with. Let's see here. So for Arian is saying that he has brown marks and his doctor prescribed 20% azelaic acid. That can help a little bit, but I probably would do something more for actually helping with that pigmentation. And that likely it could be with either like hydroquinone if you need to, or just something else for like a skin brightener. So kojic acid, licorice extract, all good options there. Azelaic acid is fine for it, but like you need something a little bit more robust if you have true brown marks. Let's see here. My scar has a hard lump and swelling. Should I keep something on it before I see you? No, I could take a look at it. See, maybe I could help you with that even there. I'm not sure what's going on with it though, but I could probably even see you there. Your job seems so fun. You're changing the world for people. It is fun. You know, the thing is that that's partly what I want to say sometimes is that I want like people to go to others who have fun with this really, because it's like, it really does take a lot of work and you got to pay a lot of attention to it. And you just have to really enjoy what you're doing, because if you're not, you're going to take shortcuts, or if you don't take it so seriously, it's just not going to be like the best results. And like, I want to make sure that I'm like doing this at an exceptional level every single time. It's really important for me just to be really doing this at an exceptional level. It's like just my, like, I'm just driven to do that. Like always, whatever I do, I just want to make sure I'm doing it very, very, very well. Otherwise I just don't want to do it. So it's like, to me, it's like, I want to make sure that like I can hit this every single time. And so it's like, it's fun also doing it, like doing it's fun, but then also like seeing the patients like a year later, it's really fun to see that. It's really fun to see that progress. It's really cool to see like, just like how much better they are for like, you know, it's just awesome. It's really cool. It's a really great feeling. So I don't know, find something like that for your job too, hopefully. Something that like gives you that kind of reward where it's like you see that progress over time for yourself, and like you saw that like, oh yeah, you can see where it's going. You can see that like you actually are making a difference, and you're not just like moving like money from one bank to another like over and over and over again. Like it's just like you're doing something cool. Jacob is saying, I usually get a shave from a pro at a barbershop or use an electric razor myself, but those dents. So the electric razor could be the problem. So, you know, consider using something else, and also consider what you're starting your shaving regimen with and what you're putting in afterwards. Like I used to use aftershave and I had acne prone skin. It was like the worst thing. It was like, there was like a huge push. There was like a big push in my time in like the 90s when I started shaving, like aftershave. Everyone was talking about aftershave. I was like, oh, this sounds like it's smart. Like everybody's doing it, and they must be intelligent, and like what this alcohol is, and these corporations aren't going to be lying about it. And it's like scented alcohol that you're putting on your face, and it's like just like terrible for your skin. And so like that was going on for a long time. I think people wised up about it recently, but don't put like that kind of stuff on. You can actually just use a gentle cleanser to shave. Just like Cetaphil gentle cleanser actually works really well, and you could do that. And there was actually, I forgot the brand name, but there's a brand that I use also for shaving cream that I found is really good for even sensitive skin too. I'll mention it one day when I look back at what it is, but definitely don't do like random things afterwards too. Like don't do that. Is Phillips one blade safe to use? Probably, yeah. One blades are good. Do that. Just don't nick yourself too much. What is the recovery like for TCA Cross alone with all those white dots remain red and stay red? It's usually just about 2 days, typically about 48 hours usually. Jacob is saying, I thought electric shavers are better because they don't go under the skin. Should I always go to a pro? You don't need to go to a pro always for your shaving. Electric razors just cause more friction. So the problem is that they cause more friction, and that could cause more inflammation and cause more scarring. That's actually the problem. So I don't love the friction that electric razors could cause. And so a lot of times if you go through the history of somebody, a guy with acne along the jawline, for example, on the neck, you ask them what they're shaving with, it turns out they're using an electric shaver. So just something to pay attention to. Just use a different one. Can you answer the TCA question again? There was a lag. Yeah, sure. So TCA recovery is just about 2 days usually. And I don't really get as much redness as a lot of other practices because I don't use like a very, very high concentration on each individual scar. I change the concentration depending on the depth of the scar. So if it's not that deep, I'm not going to actually use that high concentration. There's some guys that will argue, they used to argue, and they don't argue anymore, but they used to make these claims that you just have to use like 80% to 100%, otherwise it's not effective. And it's just so not true. This patient right here, we did not do that. Okay, so it's like just it goes to show that a lot of the stuff that people were saying wasn't true. And sometimes you have to just think about it common sense wise, that why would you use the same concentration in every single scar? Why was that standard of care? Just think about that it was standard of care for so long. And people to this day, there's still some people they don't argue to me, but they'll try to argue to patients that they need to do 80% to 100% of TCA Cross on people's faces. And they're causing severe catastrophic scarring, because I deal with the scars afterwards. I'm doing like the after effects of that. So it was like a small pinpoint scar, and then it became a boxcar scar because the person used too high a concentration of TCA. So clearly what they were saying was just not true. And this consensus that they tried to make it and they tried to push on people was wrong. And it was based on inaccurate information, based on poor studies. If you look at the studies that they showed, they were never showed photos like this. Look, honestly, one day you should go through the photos that these studies showcased, and it'll be kind of just amusing to you. Just that, man, this is what they built the whole consensus on. Actually, it was wild. Actually, I actually was going down this route, and I was trying to take a look to see what should I do and how should I do these treatments for myself and things like that for my own sake. And I was looking at the studies, and I was looking at these photos, and I was like, what? This is what they're this is what they're basing it on. And it'll be an N of 4 people or something like that, meaning they did it on 4 patients, and now this is the consensus. They did 4 people or 3 people or 2 people or 1 person sometimes, and they're like, this is the case study, and this is what we're going to base everything on. And it's wild, actually, when you actually look at this. It's really, really terrible, because it's so many people could have gotten treated properly if they didn't get stuck in this world of just self-affirmation. Everybody's just this is what we do, and this is the way to do it. And it turns out nobody knows where it came from. It came from a garbage study of 25 years ago. Vinny's saying, I've been very depressed and socially withdrawn from my nose scar, having bad anxiety, and it's hard to not pick it. I'm sorry, Vinny. I will help you out with that. That's a common issue, because especially on the nose, it can be really tough. The thing is with the nose is that you may not get perfection again. It's possible that you don't get perfection again. I want you to be aware of that, though. It's unfortunate. We'll try to make it better as best as we can. But the nose, it can take a lot more work than you may expect. It just doesn't heal as nicely. So a little bit less predictable if you go too strong with it. So you have to go pretty cautiously with it. And it's a slower process than you may expect. So, I'll try to make it so that you're less socially anxious about it. But we'll also have to kind of figure out ways to accept it in some point, because sometimes it's just that's part of what you have. You may have a scar there, and it's just, okay, it's there. We'll make it so that it's less noticeable, less visible to people, but it's sometimes you get the complete perfection. Especially on certain spots like the nose, it's we have to kind of walk you through this process and showcase that it may not be able to get to that. Can you recommend a razor to use to shave to prevent scarring? Just get Gillette right there, whatever the 5 or 6 things that they have, the 6 blades or whatever it is. Just get the most blades that they use on there. How would you treat post-inflammatory erythema or red marks? Nothing deep, just red. Just do 10% azelaic acid, actually. Really easy. Just do 10% azelaic acid, a lot of moisturizer. That's probably all you need to do. If you need to do a laser, if it's not working, responding, we can use a laser to help with that. XLV works well. All good options there. What can you use to help with rosacea? Again, the same type of thing, actually. XLV works well. With rosacea, it's a longer topic, but avoiding the triggers, those are things that you really want to pay attention to. Controlling also, sometimes the oil production is important as well. The inflammatory process, sometimes it can be antimicrobials, things like that. Is every acne scar permanent, or can it get rid of 80 to 90% of it with treatment? So the percentage thing, I think just the one thing, just get rid of all the percentage concept. Just all that talk about percentages, just throw it out the window. I don't know what it means. You don't know what it means. The person next to you doesn't know what it means. Nobody knows what it means. It's so variable. The things that we're trying to achieve is that it's less noticeable to day-to-day lighting. That's what we're trying to achieve. That's achievable. Some scars do appear pretty close to invisible. Now, if you look at it with really harsh lighting, maybe you can still see that scarring. That's not day-to-day lighting. So don't worry so much about how it's going to look under a flashlight, or how it's going to look in the elevator sometimes, things like that. It's not as important as you think. Day-to-day, regular lighting, it's not as visible anymore. That's what we're going to try to achieve. Sometimes I see patients and I can see it like 15, 20 feet away, and then it's amazing. After a year and a half, 2 years, we now have to see it under really harsh lighting. That's really cool to be able to get to that. And that's, I don't know what percentage that is. I have no idea. What is that percentage? I don't know. So is there still scarring? Yes, because we're looking at it under really harsh lighting, but it looks really awesome. Under regular day-to-day people are not going to notice that. You're not going to notice as much when you wake up in the morning, look at yourself in the mirror. When you go to the washroom during the day, when you go at the end of the day, you're not going to be noticing as much. You're not going to feel that people's eyes are drifting to the scars as much. That's a pretty cool feeling. That's achievable. That's what we're trying to achieve. That's what the goal of this is. So don't think in terms of percentages anymore. Like the whole concept of percentages just need to move on. Is that for hypertrophic scars in the nose? No, for atrophic scars. Hypertrophic scars aren't as hard actually. Hypertrophic scars I can actually improve a lot. The hypertrophic, not as worried. It's the atrophic scars that can be really tough on the nose to actually get that complete correction. It takes a lot more work. It's just a lot slower. Something just to pay attention to is that if you have atrophic scarring on the nose, it just sometimes could be a patience game, really. It's not going to be that's it. But, don't pick it. Like I know, Vinny, you were saying that you have bad anxiety and it's hard to pick it. It's tough. I know it's tough. You're focused on it, but also wait to talk to me and I'll help you out and see what we can do for it. I'll take it really seriously to walk you through to get you there. Vincent saying, hi doc, how do you know if you have sensitive or rosacea skin or acne prone skin? Cause my face is red, please advise. Well, sometimes it fluctuates, like the redness will fluctuate just with maybe a little bit of spicy food or alcohol. That could potentially cause it to flush or feel a little bit hot. And that's more like in that category of rosacea. Acne prone skin, with a little bit of redness, sometimes you have those little red marks after acne. That's what we call PIE. And that's very, very different. So, it varies in terms of what your, what the reason why you have the redness is and how diffuse the redness is. It's like blotchy kind of redness. That's more likely going to be a rosacea. I'm up saying, do they still look smooth even under harsh lighting after treated? This is harsh lighting right here. So it looks smoother. Is it completely smooth? No. So this is harsh lighting right here. So it's smoother, but is it completely smooth? No. And that's why I want to show this to you. I want to show this for you so you can see this. And so it's like you can understand there's a lot of people out there, that are showing you selfie results over and over and over again, or they're showing results of different angles, it's just not consistent. And, some of these guys, they have photo studios, they have all sorts of stuff, and all they do is show you selfies. And sometimes it's filtered selfies, and it's like, and they want you to do this, and they say that they're going to get you this perfection. And I want to always show, yes, can we sometimes get pretty close to perfect? Sometimes, yes, it's possible. Sometimes. But I want to show that to you, that it's still, if you look at it, yes, there's some scarring under harsh lighting. And if it bothers you, if you're looking at that and you're like, man, this guy paid so much money and there's still some scarring under harsh lighting and that I'm just never going to be able to be okay with that, then this isn't for you. This is just not for you. I'll tell you that right now. And if you think that somebody else is going to do this better, and go look at their page and you'll see that a lot of it, what they're doing is with selfies, and they're showcasing selfie results over and over again. But feel free, go for it. I want to showcase exactly what to expect and what is a realistic outcome for so many of our patients, and it's I can't share every result, unfortunately. I have a lot more results than on my page, on my drive, that I wish I could show. But some patients are really sensitive to it. They know that they can't even be that it's not something that other people will recognize. But sometimes they say that I just don't want to remember where it was beforehand. I understand that, but it's important also for people to see what we could get to. And so if you're okay with it, I'm super happy, and I'm very excited if we can showcase that for people. So thank you for everybody that lets me share. I really appreciate you guys, by the way. Some of you guys are on the lives right now, so I appreciate you. I see a lot of familiar names on there, a lot of people. I appreciate all of you guys. Dr. Abisi is saying, the point is some patients keep asking us to do a few more sessions after achieving these levels of results. So it is possible sometimes if you're doing different types of things to get better and better results. There is a way to do it. If you're doing the right modalities, you could do that. But it's still like under very, very harsh lighting, you still may see some scarring. I just can't say for sure. If you're like there's a lot of factors. Your genetics play a big factor. Your ethnicity plays a big factor. Whether you used to smoke or still smoke, all those things play factors. How much sun exposure you have, how much oil production you have. All that can contribute to whether or not you have an excellent result or not. Of course, just your skin type itself, like how much we could push the lasers, how much we could push like the TCA Cross, all those things, how much volume loss there is, how much you're willing to invest. Are you like open to everything I'm saying to do with this, or are you going to kind of pick and choose? Those things all matter. And it turns out sometimes when it's like people that will say like, it wasn't the full or complete type of result at this point. Well, we didn't do everything yet, or like you opted not to do like the volume replacement yet. You just didn't like the idea of doing filler, but you're never going to achieve, a fuller result until you put some volume in there, like Bellafill or Sculptra or Radiesse, because like this patient, for example, even though it's not super obvious right now, when he's animating, when he's smiling, he did have volume loss. So we had to put some Bellafill in there to achieve this result. It's not possible without putting some volume in there. All the texture in the world, smoothing all down, isn't going to solve the fat pocket loss there. So you have to do something for volume. Phenol peel, do you recommend it? I did a really, really good case actually 2 days ago with a phenol patient. Really, really good case. He had done lasers so many times. He came all the way from New Jersey, and very, very thick scars. Like for that patient, it made a lot of sense to do phenol peel. He's a Fitzpatrick 4, really made a lot of sense to do phenol. And then today I did dermabrasion on him, manually broke down his scars some more. So that's where it's useful for with thick scars. A lot of times also for patients that had failed laser treatments before, things like that. But it has to be really the right patient, and you need to make sure that they're doing everything else afterwards too. That's another thing. You have to follow along the steps to make sure it's super safe for them afterwards. My skin looks like this right now. I'll be happy to help you whenever you're ready. We'll help you. We'll help you out there. Where was I at? PIE is so hard to fade. I tried azelaic acid 10% from Paula's Choice, but it broke me out instead. Yeah, it may have been a little bit too harsh, even though 10% is usually a little bit lighter. So you could actually just use a moisturizer immediately afterwards, though. So there's no problem with that. Just use like initially to try to get yourself used to it. Start with 10% azelaic acid for the first couple of weeks. Put Vanity cream immediately afterwards, and then you can slowly get yourself off of that. Should be okay. Honestly, I think it should be okay doing it that way. When does redness from scar treatment go away? What's your skin type, user 24? You were asking that though. So sometimes for East Asians, it could take like 3 months sometimes. This patient's East Asian. It took him probably about 2 months, I would say, for him, 6 to 8 weeks for him. Can you explain how the pigmentation cream works? Why does it cause redness? Well, it may be a little bit drying for you right now. So use almost like a half a pea size amount and put a lot of moisturizer on there. So that redness is actually probably just from irritation at this point and just dryness. So do that really. Can severe acne scars be treated with only CO2 laser in 6 months? Probably not. Probably not going to change too much of that. Do you ever change your modality the day of surgery? Yes, sometimes, really rarely. I usually tell patients during the consultation that we may need to do something else for certain areas, like potentially I have to double check to see if I have to do some excisions. Sometimes excisions are a game time decision. When I'm touching the skin, if it's a virtual consultation, I'm pulling on it. We'll see how deep it is and if it's really worth us to actually take out that scar tissue. So something like that potentially we could do. And then if there's other areas I'm looking at it maybe a little bit deeper, we may need to do a little bit more volume either that day or in the future. I'll tell you to do some more volume for the amount of fat loss that's there. So sometimes, but I go through it very, very systematically, and we'll have a very, very good game plan when I circle all the spots that we're going to go through and treat and really come up with a really good game plan for us. And it's so rare for me to deviate from that, to be honest with you. Can Tazarac help with shallow ice pick scarring and shallow boxcar scarring? It could probably help because it may shrink it a little bit. So user 24 saying that they had redness and they're East Asian. So from the scar treatment, they had redness. So that's what I was talking about. East Asians sometimes have prolonged redness. Sometimes you have to use more moisturizing and less of the harsher chemicals, less exfoliants, just more moisturizing, more sunblock, and then you could slowly reintroduce the exfoliants if it's taking a little bit longer. So you probably have to step back on what you're doing and instead do more like Vanity cream, sunblock, give that a shot, and then slowly we can reintroduce something like azelaic acid potentially. And if it's needed, we could do like XLV for some small spots. Can all indented scars cause fat loss even if they aren't tethered? Good question. Maybe like small, like deeper pocket ones, like something like ice pick scars could do that, but it usually is more clustered. It's like one or two little pockets of that. I doubt it's going to cause much of a problem. Dr. Abbasi, appreciate you. Thank you so much for coming on. Thank you for the kind words. Am I ever going to go to Dubai? Stay tuned. Maybe. We'll see. I actually, it's interesting. I obviously I do all my work over here in Orange County. I do a lot with it, and I love the fact that my team does everything for me start to finish. But I have a lot of patients from that area, and a lot of them have asked me to go there. So I'm hearing you. I got it. I get it. Like actually, a lot of people are suffering from scars like all over the world, and it turns out actually Dubai is like just a few hours away from like I think it's like 2 billion people. Interestingly enough, so. I think there's a lot of people, that sometimes I may just go there just for a little bit. We'll see. We'll stay tuned. Maybe there'll be something to come up with soon, some point. But I have a lot on my plate right now, so we'll see. But maybe I may do that, something like that. So just to let you know, something I'm thinking about. A lot of people coming on here and were asking me to do it to go to Dubai, and I have a lot of patients actually from that area or like from around there that were saying that's like a central spot for them. So. Something I'm definitely thinking about, but like right now I'm really busy at this point over here, but like maybe if I could get a little bit of time to do something like that and squeeze a bunch of patients all at once, I will consider it. If it's like a good practice that I could work over there that has like the right lasers, everything like that for me to use, I will consider it. Do you do fillers directly underneath the acne scars? Yes, yeah, you could do it actually that way, especially like Bellafill, you could do directly underneath there. I'm sorry, I didn't hear, but did you say Tazorac can shrink your scars? Well, it could help with the oil production. And when you work on oil production, it could actually shrink the diameter of the scars. So it's possible, yes. The Tazorac could help with that. And then that could actually potentially help with collagen production. I'm 28. How does age play a factor in treatment? Well, at your age, you're still going to get a really nice collagen response. Even I have patients in their 70s, to be honest, we can still do it, but it's just a matter of sometimes of being a little bit faster at a younger age. So younger patients, sometimes you just get faster. Also healing, a lot of times just they could bounce back a little bit faster for things. So sometimes you get a little bit more delayed the collagen response with like older patients, but a lot of times also there's other factors too. So it's like sun exposure, things like that. I've also mentioned before, ethnicity does factor into things too. So things you can control, things you can't control. What you can control is sun exposure. Don't start smoking, vaping, things like that. Don't start, I don't know why. I've had some people like as they got older, they started vaping later on, which is interesting. What bothers me about a lot of doctors is that they show before and after of patients after a week of treatment when the face is still swelled up. Yeah, absolutely. And that's why what I always try to showcase, like this patient, for example, over here, this was the first one we did was July 24, and then now it's January 25. And that's like what I like to showcase. It's like this longer process. I want to showcase that collagen response. And this patient, he comes all the way from Baltimore, so I don't see him like all the time, but like it's nice that we could see that progress then over from July to January right now. And I think that gives us a more realistic understanding of how to do this. So I'm going to wrap up right now. Did I mess up there? What did I mess up with the questions? I just got kind of confused with a few of them all at once. Let me see if I can hit a couple of them just before I end. Is treating pink-purple pigmentation on really pale skin challenging? No, not necessarily. It won't be. So not really. What ethnicity do you think gets better results? Interestingly enough, South Korean patients, especially South Korean women, it's just like the amount of collagen response is so fast actually, and the healing recovery is like really fast, interestingly enough. other East Asians too, but like particularly I find with South Koreans, just it's interesting. Very, very fast like collagen response. It's like sometimes it's like I look at it and it's like, wow, that's really, really cool. Like just like already the lateral cheeks like almost completely gone. A lot of times, by the way, with that particular ethnicity and gender, so South Korean women, a lot of times I see more with like ice pick scars, some boxcar scars as well. And it's like in the middle cheek and then in the lateral cheek. And I'll see like, okay, we did it on the like combination session. The lateral cheek, a lot of times it's like very, very smooth, very, very quick. And sometimes there's still a little bit still in the center. And then you start hitting that a couple more times and it looks pretty close to scarless. But sometimes, there's, I did find though that there's a lot more pressure though, sometimes with trying to get perfection. So I do have to have a talk a bit with that, to say that it's going to take a long time still to get closer to what you're trying to achieve. And we may not be able to achieve it, still, that part, we may not be able to get completely smooth. But I have found that South Korean women, fast recovery time, fast collagen response, interestingly enough, a lot of times with the like redness, it's not as much of a problem. So, interestingly enough, too, they're very, very good with sunblock too, so you don't get pigmentation as much too. So interesting. Let's see here. How do I get rid of Phoresis spots on the lips? You could just zap those. So you could use either an erbium laser or a Bovi, but it does come back a lot of times. I always want to counsel patients what they're placing on there. And a lot of times you'll hear that they're using like Carmax or like something like that, like some sort of occlusive, a lot of times it's like, what's it called? Chapstick or whatever else. And that could be the problem. Does laser shrink hypertrophic scars? If it isn't a keloid, then I could do it that way. Yes, I could just burn down that hypertrophic scar. So it sounds like, Vinny, that's what you had for your acne, for your nose. And so you don't have to worry so much. Don't pick it. We can help you out with that. Do you ever find that the improvements in scars after treatments by you is not as great as you expected? Yeah, I have found that to be the case. And I tell people that. Sometimes it's very rare. Honestly, it's extremely rare. But a lot of times it's just a matter of like not enough time. Sometimes it's due to the fact that there's more oil production than I may have liked. I did, maybe they were out of state and they didn't let us know that they had breakouts, things like that, in between the sessions. And that could definitely be a huge factor in making sure that, in not getting the best optimal results. But sometimes it turns out, yeah, I did have some breakouts recently. Yes, I have a lot of oil production. Or I had a lot of sun exposure, things like that have happened. So there's different variables, but there are times when you do like a really you try to do your best to get the best result. And sometimes it's like, man, the collagen response wasn't the best right there. And I'll tell you honestly, like I stand by my work and we do have that policy where we do, up to 55% off for future treatments. But if we're looking at it, and it's like, this doesn't look like it's much different at all. And like, I'll just take care of it for you, to be honest with you. Don't abuse that. Like, please don't. Like, I had to change some policies here and there because some people were abusing certain things, but I try to be extremely honest with a lot of things with all this stuff. And I want you guys to be extremely honest too with these things. So tell me what it is, what's how you feel with things, and we'll walk you through it at that point, 6 months, a year later, to see where we're at. But we're looking at it and we're seeing objectively that it's, the same. And it's like, okay, I'm not gonna try and nickel and dime people. I'm not sure why that happened, but I'll try to take care of it to get this better for you. And it always does. If we end up now doing another session now and I have to fix this, to get this better result there for you, then we will. But now if I told you that we needed volume, we needed this, we needed that, or you just didn't want those things, that's a different conversation. But if we did everything that we needed to do to try to solve it and it's still not there, and it's not there at the different touch points that we have, then it's okay, let's figure it out for us. Let's try to see what we could do for it. And I really do stand by my work. I really do. So it's there's times when I have to just look at this and look at it objectively and think, I don't know, why did this not get the full, maybe I did kind of hold myself back a little bit because of safety reasons, because I always try to balance safety and results. But maybe in this case, I could have pushed it a bit, or I look at them I probably couldn't have because of skin type and it was okay. And it was fair. I didn't do that, but still it wasn't enough for this person. And they did all this investment and we'll help you with this now. And the second shot, in the second step, and we'll do it. So, that's all I am. I will help you out with that. So I wouldn't even worry about that. And if you see anybody that is worried about that, just know in the back of your mind that they all have had that chance for me to make it better for them. And it's like, some people don't want to do a volume when they need volume. And it's like the only way that we're going to solve this is going to be with something to give you volume. And I understand if you don't want like certain fillers, things like that, but we got to do something for volume. And outside of fat transfer, I could cover that, some of that, so it's like we could talk about like just work on it, try to take care of it like yourself, make sure you follow my steps, but I will get you to the optimal results eventually. You do your part and make sure that you're doing like do your things and don't go out in the sun, be safe, and we'll get there for you. All right. I appreciate everybody on here, by the way. And, yeah, I'm hearing you. I'll think about Dubai as well. Appreciate you guys from Dubai. They're coming on for that too. And definitely a thought process at some point. So I miss a few different things here, but I know a bunch of questions here. We're right here. Someone's saying that I wish treatments weren't so expensive. We do take almost all financing options. So take a look at that. Almost everybody's does that when it comes to like a bigger package. If that makes sense to you, do that. It's like, no interest and stuff like that for a long, long time too. So consider that. I have a big hypertrophic and rolling ice pick scars with discoloration. I can help you with that, Vinny. So don't be too depressed, Vinny. I will help you with that. I appreciate everybody. So this was last final thing. This was with Subcision. This was with TCA Cross. This was with ablative CO2 laser, fractionated CO2 laser, erbium laser, and then some Bellafill as well. I appreciate everybody. Thank you.